My name is Dr. Ginger Edgecombe Dorsey. I am the Acting Director of the Target Center, and I'll be presenting today's Discovery series for you. Today we're going to be talking about discovering how ergonomics can promote health and reduce secondary injuries. One of the things that I like to do before I begin presenting is just to give a brief definition of what ergonomics is. There are so many different definitions available that it sometimes becomes difficult to truly understand what exactly we're talking about when we talk about the term ergonomics. And so basically when we think ergonomics, we really just want to think about fitting the job or the task to the worker. Now there are other individual definitions out there, such as seeking to improve the interaction between ourselves and the equipment that we use to perform our jobs. But we really want to come back to the easiest and the simplest definition of fitting the job to the worker. Ergonomics at the same time can also be thought about as designing workspaces to help improve job performance as well. As we move forward, today I want to let you know what some of our objectives are going to be, such as learning various ergonomic principles to help reduce your risk and impact of musculoskeletal injuries, as well as illnesses and disorders within your work environment. We'll also become familiar with how ergonomics may help to limit the onset of secondary injuries. And then lastly, we'll talk about what are some of the different types of workplace prevention strategies available to you. So when we think about ergonomics, again, if we're talking about trying to fit the job to you, then there are several principles that we actually want to keep in mind as we go along. First of all, we want to make sure that we're always working in what is termed neutral postures. And basically that means we're trying to work in those postures that place the least amount of stress on our body. We also want to think about reducing excessive force, which is going to include any type of activity or task that involves lifting, pulling, or carrying heavy loads. Also looking at limiting extended reaches. When we think about our work environments, are those items that we use quite frequently within an arm's reach? If we had to lean forward to use particular items or to get a particular item, we know we need to bring it much closer to us so that we can remain in the neutral postures that we desire. We also want to think about whether or not we are actually working at correct heights. When we think about precision work, this is going to be work that might be very small in nature in terms of the size of the actual item that we might be working with or how close we need to be to something. And in that regard, we want to make sure that the surface height that we're working at is above elbow height. When we think about light type work, which is generally the work area that we typically may work in, particularly if we're in an office environment, our work height should be just at or below elbow height. For heavier type work, the work surface should be about 4 to 6 inches below elbow height. When we look at, I provided you an example here of this picture of the difference in terms of what the appropriate work height would be for the task that's being done here. These individuals are actually counting specimens. And when we think about it, you can see that some of the individuals are standing and some of them are sitting. Those who are standing, you can look at their posture and you can see that they're bent over, kind of hunched as well, maybe leaning off the edge of the work surface. These type of postures are going to place us in awkward postures or take us out of that neutral posture that we talked about as well, and put different types of strain on our body. Even though you have the individual sitting in green, when we look at their height, again, you would question, is this the right height for them? Looking at their head position, they're having to bend their head over. Is that going to work for them? Is that the best posture? Or do we need to put them in a different position as well? So again, just simple things to keep in mind when you think about what is the correct height. If you happen to be sitting at a work surface right now, listening to this webinar, if you just put your arms in a 90-degree position where possible, you can still think about whether or not where's the height of the surface relative to the height of my arms in that bent position. Is the surface above my arms? Is the surface below my arms? What is the actual height of that surface? And again, that's something else that can tell you whether or not you're working at the right height. Another principle that we want to keep in mind is the need to reduce excessive motions. This is going to include anything from frequent reaching, lifting, or even carrying actions. A couple of other principles that we want to remember as well would include the use of static postures, and this is going to be where we're maintaining fixed positions over a long period of time. A lot of times we see this type of principle being not necessarily followed as well as we'd like when we're standing to work. And then finally, another principle that's really important for all of us to remember, and might be easier for some than others, is to keep in mind the need for us to move, to stretch, or to exercise regularly throughout the day. Generally, I like to say at least once an hour that you take a 5-minute break. And again, that can be anything that allows you to change your position, your posture. If you go get a drink of water, go give someone a message versus emailing them or calling them. Anything, again, that's going to allow you to change your posture and just to remove yourself from in front of your computer or remove yourself from the task that you might be performing, allowing your body to take a break and to re-energize itself. So when we think about these different types of principles overall, we have to keep in mind that we really need to consider the individual worker. Consider yourself, okay? We also want to keep in mind, as we're considering the individual worker, that there's no such thing as the average person. If you happen to be listening to this presentation with a group of individuals, okay, great. Okay, I'm not sure what point that we may have lost audio, but I think I was just talking about the beginning of this slide. And so I just want to repeat what I said, and I apologize if you already heard me as well. But again, if we're thinking about the different types of ergonomic principles that we've just covered, we also want to make sure that as we move forward and we think about our work environments, that we're taking the individual worker into consideration. When we think about that, that means that we're keeping in mind that there's no such thing as the average person. Again, if you happen to be listening to this webinar in a room full of other people, or if you happen to be around your coworkers, when we look at each other, we can see we're all different heights and sizes and so forth. And so again, we want to make sure that we're adjusting our work environment so that it fits us and not necessarily the average person. We also have to keep in mind that it's not normal to be in pain. So any type of discomfort that we might be experiencing that's related to work, we want to make sure that we're letting someone know that we have this discomfort so that we can address the situation as early as possible, as opposed to waiting until that discomfort has become something much worse. As individuals, we have to keep in mind that we're going to respond differently to our work environments. And this could be due to anything such as our hereditary, our age, as well as our gender and our lifestyles. So when we think about ergonomics in and of itself and some of the principles, again, that go along with it, when we're not in harmony as such with meeting these principles, that is when we stand to experience what we would consider to be secondary injuries. And again, if we're thinking about individuals, whether we currently have a disability or we don't, if we're not maintaining or adhering to some of these principles, we can certainly see other types of injuries coming on. And these type of injuries, we can look at them as work-related musculoskeletal disorders. We can also look at them as cumulative trauma disorders or repetitive strain injuries. These terms are somewhat synonymous with each other, but throughout this presentation, I will use the term work-related musculoskeletal disorders. So what exactly are we talking about when I use that particular term? Basically, these are disorders of our muscles, our joints, as well as our cartilage, ligaments, nerves, tendons, and spinal disc. Work-related musculoskeletal disorders typically occur in our neck, our arms, as well as our back and our wrists. The one thing that's important to keep in mind here is that these type of injuries or disorders typically happen over time. It's not something that we we tend to see happening overnight, such as with a slip, trip, or fall. So what might affect, and I'm going to call out one person here, Anne Spivey, what might affect her in a matter of 3 weeks may not affect Greg Goodman for another 3 years. And again, this is something that is taken into consideration, that individual, and that we're not all going to respond to our environments the same way. Now, just taking a little bit of a closer look, some of our most common work-related musculoskeletal disorders include carpal tunnel syndrome and back pain. Some of the causes of carpal tunnel syndrome would include poor wrist postures and repetitive motions. Some of those symptoms might include pain or numbness and tingling in the hands. You may also find yourself frequently dropping items and or experiencing decreased sensation in your hands as well. Back pain may be caused by lifting heavy objects, twisting, perhaps you're standing too long on a particular surface, and because of those things, some of the symptoms that you might experience may include pain or tightness in your back. Sitting may become very uncomfortable for you as well. And so again, these are some of the things that when we take into the principles of ergonomics, we can try to avoid experiencing some of these types of work-related musculoskeletal disorders. I just wanted to provide you with a couple of others that you might be familiar with as well, such as tendinitis. The causes of that would be from repetitive and forceful hand and wrist motions. Some of those symptoms might include pain or swelling at the wrist as well. Rotator cuff tendinitis is another one you might be familiar with, and that may be due to elevation of the arm, and you may find that you have shoulder pain when that is the case as well. Some of these environments, such as here, if you're working in a laboratory environment, the type of laboratory work that you might be doing may put you in a position where you may regularly experience the elevating of your arms. Now, some of the causes of work-related musculoskeletal disorders are going to include awkward or deviated postures. Again, if we think back to what we talked about in terms of the principles of ergonomics, we're looking at, that neutral posture. Are we able to maintain that neutral posture? And so when we're not, we're looking at awkward, deviated postures. Some of those might include cradling the telephone between the neck and the shoulder, as opposed to using a telephone headset, for example. Perhaps if you're in an office environment and you're using your computer, you might be looking at your monitor. It's placed to the side as opposed to directly in front of you. We also have to consider highly repetitive work, such as keyboarding. How long do you sit and work and use your keyboard before you take a break? Lifting is something else that we might have to consider, again, depending on what environment you might be working in. And then you have things such as excessive force, for which mousing, depending on the size of that mouse. If the mouse is too small for your hand, you might find yourself gripping the mouse a lot more than what you need to be. Even stapling. We may not do a whole lot of stapling these days, but that is something else that could lead to excessive force. A few other causes of work-related musculoskeletal disorders from an awkward posture standpoint might include overhead reaching as opposed to keeping your arms below the shoulders, bending at the back versus using your legs. Again, we mentioned twisting, outstretching your arms and legs, even gripping, crouching your shoulders as opposed to keeping them relaxed, slouching, and even bent wrists. These are all different types of awkward postures that we want to try to avoid as much as possible. Now, when we think about putting all of these principles, these ergonomic principles into play and thinking about what causes, the possible causes of work-related musculoskeletal disorders as well, and what brings about the onset of secondary injuries, we really want to begin to think about what are some of the ways that we can avoid experiencing these secondary injuries. And that's where we're going to talk about prevention strategies. Primarily, we want to think about prevention in the form of engineering controls, administrative controls, and the use of personal protective equipment. Engineering controls are going to be our most preferred method of control, and basically this is because we're actually able to take out the risk factor that might exist within the work environment. Typically, when we implement engineering controls, we're looking at changing the physical feature of the workplace. From an administrative control standpoint, here is where we're looking at changing our work practices or the way that we actually perform our work. How is our work organized? Improvements typically require continual monitoring by upper management and our supervisors, as well as our own personal feedback, employee feedback, to make sure that any improvements that are implemented are actually effective. Training typically goes along with administrative controls, and that is something that we want to make sure that we're combining with any workplace changes that might occur. The use of personal protective equipment, this is actually our least effective control method. The reason being is that we're actually still exposed to the risk factor or factors that might be present. But it is a way to somewhat give some relief as necessary if we're not able to implement administrative or engineering controls. And some of those examples might include knee pads if you happen to be someone who's laying carpet, or even the use of anti-vibration gloves if you happen to be in an industrial type setting and you're using powered hand tools. But let's take a closer look at what some of these control methods might include. So for engineering controls, again, basically we're looking at rearranging, modifying, or redesigning, replacing, or even providing various types of tools or equipment, workstations. We look at the parts, what is the actual process to perform the task, what are the products and materials that we might be using as well to complete our task. Some of those things, I've given you a couple of pictures here, might be the use of a dolly or a scissor lift to help put things, to help transport items, number one, with the dolly, or even to help put things within a zone or a height that's more comfortable for us to work at. When we think about administrative controls, again, we want to think about our ability to alternate heavy tasks with lighter tasks. Okay, can we provide a variety in the work tasks that we perform to help eliminate or at least reduce the amount of repetition that might otherwise be present? What about our ability to adjust our work schedules or our work practices? We also need to make sure that we're providing enough time to recover from some of the tasks that we might be performing. And when we talk about recovering, again, this is that opportunity to take a rest break, to re-energize your body, to give your muscles a break as well. We can also look at modifying our work practices so that we're able to perform the bulk of our practices within what we consider to be our power zone, which is going to be between your shoulders and your knees. Okay, this is where we're going to be the strongest with the work that we're doing. We also want to consider our ability to rotate workers through different jobs so that we're able to use different muscles, different body parts, and at the same time even various postures to perform the work that we're doing. Again, we want to try to avoid maintaining one posture for long periods of time or using the same muscle group for long periods of time as well. So when we talk about promoting health overall, and again, keeping in mind everything that we've just talked about, one of the ways that we can go about trying to ensure that we are properly implementing some of these prevention strategies are going to involve conducting an ergonomic analysis. We want to make sure that, again, we're taking the worker into consideration, but also their work site in and of itself, or the task that they're performing as well. When we're able to conduct a proper ergonomic analysis that takes into consideration the ergonomic principles that we've just gone over, as well as what are some of the causes related to work-related musculoskeletal disorders, we can then look at decreasing our risk of injury and illness, and in this case, secondary injuries. We can also look at enhancing our productivity as well as improving our quality of work life overall. To give you a little bit of a closer example, some of these changes that we might be working to avoid the onset of secondary injuries might include going to a sit-stand workstation where perhaps we're standing to work part of the day or periodically throughout the day, or at the same time making sure that when we do sit that we have the proper things, the proper tools in place to make sure that we're able to maintain postures that don't place additional stresses on our body. Some of those things, keep in mind, might include the use of an alternative keyboard, okay, or some people like to refer to it as an ergonomic keyboard, but I like the term alternative keyboard. Even a different type of mouse. What I pictured here is what's called a vertical mouse. Okay, that might be a consideration that we need to consider as well, based upon what type of injury or discomfort we might already be experiencing. If we happen to be in a laboratory environment, there are things that you want to take into consideration there. In the first picture, the picture on your left, you see the individual the laboratory worker is bent over, doesn't have a lot of knee clearance and so forth to be able to look through the microscope that she's actually using. In this case, in the second picture, what we've noted here is a method of getting around and having the ability to put her in a better posture is that we actually remove the drawers from her knee space so that she can actually get closer to the microscope, which would allow her to use a more upright posture overall when she's using that microscope. If we happen to be in a more industrial type environment, perhaps we might look at if we have to carry items, how small is that grip that we have to use to be able to carry something. And so we want to consider whether or not we have the ability to build up the handle that we might be using. And in this case here, we have a pail that an individual is using, and they're carrying the handle on the pail, but at the same time, we look and we can kind of see the forces that are being applied in the ability to be able to carry that pail with the regular grip that it has. But when we build up that pail handle, we're able to use less forces to be able to grip that pail. Okay, something simple, but it makes a huge difference when you're having to do that type of work. Another option might be to consider, instead of sliding or pushing something across the floor, do we have the option of using a dolly? Okay, by doing that, we place less stress on our body and we let the dolly do the work for us, or the cart do the work for us. If you happen to be one who operates a vehicle and you do a lot of distance driving, some of the things, there are many different things to take into consideration, but one of the things to consider is, what is my position overall when I sit in my seat? Are my knees higher than my hips? If so, that can place additional stresses on your lower back. We want to make sure that in this particular case here, that we're able to sit with the height that enables us to keep our knees level with our hips, or actually even just below our hips. And sometimes that might mean the use of a seat cushion of some sort, or a seat wedge that will give you a little bit of height in order to allow you to sit with a better posture, and again take some of that pressure off of your lower back. And I'm just going through, what I've done here is I'm just going through some of the different types of environments that you might find yourself working in, or different types of environments that you may experience discomfort, or where there's a potential for the onset of secondary injuries. Again, keeping in mind that there are many different environments that we work in, and here are just some of the ones that I'm showing that are common to those of us within USDA. Now, a few other improvements that you might want to consider as well is the use of anti-fatigue mats. Okay, again, if you're standing for a long period of time, this is something that can help the use of an anti-fatigue mat is something that can help to reduce pressure to the lower back as well as to your legs. Okay, because it's providing a buffer between the hard surface that is beneath you and your feet. You also might want to consider the type of footwear that you use. Is it supportive of you? Is it appropriate for the type of surface that you have to walk across? And then even the use of foot supports. Okay, that's something else that you might want to consider as well. Again, making sure that you have enough arch support and just enough cushion in your footwear as well. And then finally, we want to make sure that we're, again, taking into consideration the number of rest breaks that we incorporate throughout the day, and just what are our work habits in general. The more that we can move, the better it is that we're going to be able to avoid maintaining static postures for long periods of time, or just postures that may be awkward in and of themselves because of the nature of the job that we might be performing. And so to recap, again, there were several different ergonomic principles that we went through, such as, again, trying to avoid repetitive motions, working in neutral postures, avoiding excessive force, as well, and so forth. These are going to be things that we once again want to make sure that we're incorporating in any type of work environment that we may be in order to help us reduce the onset of secondary injuries. Again, we looked at secondary injuries from the standpoint of the onset of work-related musculoskeletal disorders, which again, some of those included tendinitis or carpal tunnel syndrome, or even experiencing back pain. The prevention strategies that we talked about included engineering controls, where basically we are modifying, rearranging, redesigning something within our work environment. We're really taking out whatever that risk factor might be that's present. We also have administrative controls, which generally look at providing job rotation or changing our work practices or the way things are organized, but trying to at the same time make sure that we are working within that power zone. Remember, our power zone is where we're working between our shoulder and our shoulders rather, and our knees. And then also we talked about the use of personal protective equipment, but keeping in mind that this is our least favorite control method because the risk factor may still be present. Okay, I want to go ahead and ask you if there are any questions that we have not covered during this particular presentation, if there's anything that came to your mind that you wanted more information on. And as you think about those questions, I wanted to also give you our contact information here as well, so that if you wanted to obtain more information, you can certainly do so through our website or even by sending us an email. For any questions that you have, if you can put them in the Q&A box in the center of your screen, that would be great. Okay. As you think about some of those questions, I also want to remind you that if you feel that you need an assessment, I would encourage you to start your target experience by going to our website. Okay. And if there are no questions at this time, please keep in mind that we do have several links that are available to you to obtain additional information. Those are in the box at the top of your screen under web links too. Okay, and there's also the Target Center link under the notes box as well. Okay. If there are no questions, we do have a couple of questions that are coming through, so I'm going to give those a chance to happen. Okay, so one of the questions is, where is the link to get an ergonomic assessment? Okay, again, in the box just above the Q&A box, there is a box there that says web links to, and if you click on Start My Target Experience, there you will be able to sign up for an assessment. Okay, and another question that is asked is, do we have a link for designing a standing workstation? We do have information that we can provide to you to help you with designing the most appropriate standing workstation, so the answer to that is yes, we do. What I would ask of you is that if you could send us an email through the Start My Target Experience, then that would be very helpful, because there's not just one source to help you with that. There will be multiple sources, and we want to make sure that we're giving you the right information. Okay, another question is, at the beginning of the presentation, you divided the work types into 3 groups. Please give examples of heavy work. Okay, So if we're talking about heavy work, that might be something where I have a piece of equipment or machinery that I might be working with where the weight of it is too much for me to actually lift in and of itself, and so I have to keep it at a lower height in order to be able to work with it. Anything that's going to be, I would say, I'm going to use a monitor as an example, but this is not probably the best example here. But just thinking about the height of a monitor and the weight of a monitor, that is something that if I was going to actually be doing physical work on it, let's say I was an IT person, IT specialist, and I was going to be doing physical work, that might be something that I might actually keep at the lower height as opposed to working at a higher height where my elbows are above the height of the work surface. Also, you can think of something if you happen to be working with an animal. Depending on the size of the animal, for example, that would dictate the height of the surface that you might be working on. If you're working with a small rodent, for instance, then certainly you probably want to keep that a little bit closer to you just because of the size of it. But if you happen to be working with a much larger animal, such as well, I'll say cattle or something to that extent, certainly you're going to be, just because of the sheer size of it, you would be working with something, you would be working at a lower height. Okay, another question is, can people from outside agencies come to you for ergonomic assessments? The answer is yes. Will we go to other agencies or workplaces to do an on-site assessment if they are in the DC metro area? Yes, that is something that we are able to do based upon availability. Okay, are there any other questions at this time? Okay, so again, if you have any additional questions or something comes to mind that you would like to have answered later, please go ahead and send us an email, or you can click on the links above and to start my target experience as well. We're more than happy to provide assistance. If we are not able to provide the answer that you're looking for, we will certainly do our best to work with our points of contact to obtain that information for you. Thank you so much for your time.